IV insertion supplies include IV insertion kit, which will include all the below: tourniquet, single use, disposable gloves, antiseptic chlorhexidine gluconate 2%, gauze, transparent IV dressing, drape, and clear hypoallergenic tape. A catheter with a passive and active safety mechanism in the chosen bore size, gauge, and length. Remember that catheter gauge size chosen depends on factors that include patient's diagnosis, prescribed type and duration of IV therapy, available access site or sites, size of the peripheral vein to be accessed, viscosity of solution, and rate of administration. A 10 ml pre-filled 0.9% normal saline syringe, extension set with needleless cap, catheter securement device if included. Procedure: verify order, gather appropriate supplies and equipment, explain procedure to patient, and reason for intravenous access.
Okay, Mrs. Smith, I'm going to insert an IV for you. The reason is we're going to run IV fluids, okay? We're going to give you a little bit extra fluids. Do you have any questions?
Not at this time.
Okay.
Perform hand hygiene. Don gloves. Prime extension set. Flush IV lock with 3 ml of normal saline. Keep syringe with normal saline attached to IV lock. Perform the 5 I's. Introducing yourself.
Hi, Mrs. Smith. My name is Mark. I'm going to be your nurse.
Infection control. Identifying the patient, Francis Smith.
Okay, Francis Smith.
Date of birth.
Can you just give me your date of birth, please?
3/17/1927.
Okay, great.
Informing the patient and including the patient. In including the patient, please check and verify limb restriction and allergies. Create a clean work area at the bedside and set up equipment. Select the appropriate insertion site. Consider duration of therapy, type of infusion, condition of veins, and any limb restrictions. Use non-dominant arm if possible. Assess the vein to determine that the selected vein can accommodate the cannula. Place the patient in a comfortable reclining position, leaving the arm in a dependent position to increase capillary refill of the lower arms and hand. If skin is cold, consider the use of warm packs to promote vascular dilatation. Apply tourniquet about 3 inches above the intended puncture site. Remember to check radial pulse. If pulse is not present, remove tourniquet and reapply with less tension. Ask patient to open and close their hand. Choose a vein that is long, straight, and wide in diameter. Palpate vein to ensure that it is round, firm, fully engorged, and resilient. Release and remove tourniquet. Tourniquet tourniquet may be left in place for no more than 3 minutes while locating suitable vein. Prepare the site. Remember to clean the site utilizing friction with chlorhexidine gluconate 2% antiseptic using a back and forth motion for at least 30 seconds. Allow to air dry. Reapply the tourniquet. Now it's time to insert the catheter. Remove catheter guard and ensure that the bevel is up. Prepare the catheter for insertion. Examine catheter for cracks or flaws. Inform patient that a pinch will be felt upon insertion and that you are about to insert the needle.
Okay, Mrs. Smith, I'm going to insert your IV. You're going to feel a little bit of a pinch, okay?
Okay. Hold skin taut approximately 2 inches from insertion site with one hand while holding the catheter with the bevel up in the other hand. While maintaining aseptic technique, insert catheter at a 0 to 15 degree angle into vein parallel to the straightest section of the vein in a continuous motion. Follow the path of the vein and insert catheter towards the side of the vein wall while visually monitoring for blood return. Level the insertion device slightly by lifting the tip of the device up. Place index finger on the push-off tab. Thread the catheter to the desired length. Release tourniquet. Grasp the cannula hub to hold it in the vein and withdraw the needle by activating the needle release button. Attach saline lock to the hub of the catheter. Aspirate for blood return to ensure catheter is in the correct location. Flush IV lock with 5 mL of normal saline. Secure the hub of the catheter and cover IV site with sterile transparent dressing. Loop the IV tubing or IV extension tubing on the patient's limb and secure with tape. Label dressing with initials of person who inserted the catheter, date of insertion, and gauge size of the catheter. Access insertion site for bleeding. hematoma, ecchymosis, and pain. Dispose used needle into nearest sharp container.